Hi, everyone. I'm Walter Campbell. I'm an associate and a criminal justice researcher at APT Associates.
And I'm Melissa Nadel, and I'm also a criminal justice researcher at APT. And today we're going to be answering a question from our Ask an Expert series on COVID and prison release. So the question is, one of the ways that states are combating COVID-19 in prison populations is by releasing those who are most vulnerable. However, Maryland does not appear to be leaning in that direction. Do you have any insights into why this is and what efforts are being taken to influence Hogan's decision towards release of highly vulnerable prisoners? This is a really great question. And although we can't specifically speak to the factors that are directly influencing Governor Hogan or the different policies in Maryland, we can talk about some of the practical reasons why a state might decide not to pursue early release or why it might not be the best option for them.
Yeah, exactly. And one of the first kind of general reasons we want to talk about is public safety. So it's pretty hard to sort of determine who's likely to commit another offense, and especially who's likely to commit sort of a violent and harmful offense. A lot of jurisdictions use risk assessments to make this determination, but even among the best risk assessments that are locally validated and really kind of robust assessments, there's still going to always be false positives and false negatives. So it's reasonable for some state and local leaders to be a little concerned about this. And we actually see that in other jurisdictions like Texas and Lewis County and Washington. And then in a similar vein, it's important to keep in mind the victims of prior offenses and sort of the concerns they may have with people being released early. In fact, some victims have spoken up about early releases, and this is especially important because in the criminal justice system, the needs of victims is often overlooked.
And also relating to this issue of public safety, even if we're only releasing the people that are at the lowest risk to recidivate, a lot of the resources that inmates typically need in order to be successful after they're released and not commit crime again are either unavailable right now or severely overtaxed. So, I mean, this includes the basics of being able to find a job or housing, but also services like substance abuse treatment, medical care, mental health treatment. A lot of studies have shown that without these resources available to them, we're just setting these people up for failure, and they're probably just going to end up back in prison, which doesn't help them, and it doesn't help with reducing the spread. And also in line with kind of that idea of releasing inmates is supposed to cut down on the spread of COVID, if they don't have a place to live, if they don't have access to medical care, then they can't social distance, they can't engage in proper hygiene practices, and it may actually increase the spread rather than reduce it. So one example is the Bay Area has seen a massive increase in their homeless population since all of this began. And a lot of studies that have been done have already shown that COVID is likely to be higher among this population. So it may just make it worse instead of better. And if we keep inmates in prison, at least we know they're housed and we know they have access to some sort of medical care. So it might actually be safer in some situations.
And building off that, one of the sort of sources of all of the needs that Melissa just talked about are community supervision officers and agents. And generally, I think when people think community supervision, they think of sort of making sure people don't commit new crimes and they don't violate their conditions of supervision. But in a lot of jurisdictions, community supervision officers act as social workers. They connect people to resources, they provide resources, whether it's housing, mental health treatment, things like that. And in most jurisdictions, people released from prison don't get directly released, they get released onto probation or parole. And so these agencies were already overtasked before COVID began. Now they're seeing a big influx of new people on their caseload. And then finally, in addition, they've really had to change the way they work. Most of community supervision is a face-to-face operation. So that's another consideration.
Yeah, exactly. And then on top of all of this, even if we take all of that into consideration, there's also the issue that criminal justice practices, resources, community resources all vary a lot by jurisdiction. We don't really just have one criminal justice system in this country. We have thousands because they not only differ by state, they differ by county, by agency. There's no really one size fits all solution. So, for example, while one state may have all of the community resources available that they can release inmates safely, another state might not, and that doesn't make sense for them, and it could just be making it worse. And in the same vein, there might be some states that already have all of the prison resources they need to properly social distance and maintain healthy practices in prison, so they don't necessarily need to engage in early release. So really, there's no one-size-fits-all solution, and we can't really treat it like there is.
Yeah, exactly. And with that in mind, I kind of want to reiterate our point at the beginning where we don't really know what sort of the cause of Maryland's response is, or exactly what's going on in Maryland. But it is important to kind of keep in mind that these are some general considerations, and as these things vary, that's going to change the response of any particular state or county or city. With that, I just want to say, please keep the questions coming at #AskApt. And if you're interested in any of our criminal justice work, follow us on at AppJustice on Twitter. All right. Thanks so much. Bye.
Thank you.